I think it's out there. I wanted to ask you about rural health care again. You are supportive of the President's budget request in reducing the 101% to 100% of cost-based reimbursement for critical access hospitals.
That is our budget proposal, yes, sir.
And you are supportive of the change in the mileage limitation from 20, well, for the hospitals that have been granted a waiver and are less than 10 miles apart, you believe they should not receive the reimbursement as a critical access hospital?
Yes, that is the proposal, again, that was made last year and this year.
If you're a hospital that, we have a number of examples, many of which you're aware of. I think, well, I guess I won't put anybody on a list, but there are a number of critical access hospitals that would meet the criteria that you're now creating. And while I said in my opening remarks, I can see that being prospective, how do you take away the critical access hospital designation for both hospitals, which in my view means that neither succeed? And one of your, I can't remember who you were responding to, but you indicated in response to this issue, and maybe it was Senator Bozeman, was that they're already getting 100% of costs, but the reality is that not all costs are included in the calculation of costs. There's a definition of what costs are, and you get presumably 100% reimbursement of those costs, but they're not all costs of the hospital. At least according to the National Rural Health Care Association, 41% of all critical access hospitals are in the red now. There's less access to capital for small hospitals. They treat older, poorer, and sicker patients. And in addition to their specific and unique needs, they represent such a very small portion of any money spent on health care. So when you reduce the payments to critical access hospitals, it doesn't have a significant corresponding impact on the overall budget. And so I was interested in, I guess my question in that is any response you want to make to that, but how do you explain to two hospitals who would now no longer be eligible to be critical access hospitals that neither one of them are going to be designated as a critical access hospital, presumably losing the status and closing both hospitals?
Senator, I will share with you that I had a similar conversation in a budget briefing the other day, and frankly, I would love to work with you on that aspect of this proposal to really drill down a little bit in terms of how it impacts people if they got a designation being 10 miles apart. How far away are they from the next critical access hospital, which is, the typical is 35 miles. How did this, 10-mile structure occur? But I would love to continue that discussion.
I would guess that as governor, you granted, in days gone by, governors got to grant exemptions to the 35 miles an hour. 35 miles, I would not be surprised, but what you granted a number of those exemptions.
That could be.
That could be.